Care. How is long-term care defined? Long-term care refers to both medical and non-medical care for patients with a chronic illness or disability. Costs for long-term care, on average, costs for 3 years in a nursing home and 2 years of home care would be around $300,000. In 2012, long-term care spending reached a whopping $219.9 billion for public and private pay sectors. That's a lot of money. Expected in the upcoming years, in 2040, it'll be around $346 billion. Options for how to pay for long-term care. There's 3 different options. There's Medicare, if this is not medical, it's just custodial. There's Medicaid, and that's if you qualify. And then there's the private pay, which is reverse mortgages, annuities, and trusts can all help pay for that. Medicare, it does not cover long-term care. It does cover care in a long-term care hospital, though, in a skilled nursing care or skilled nursing care facility, and hospice and private pay. So according to the U.S. government, Department of Health and Human Services, paying privately involves 3 different things: a reverse mortgage, annuities, and then trust. There is a way to reverse your mortgage, and then you get a lump sum of that. That does not have to be paid off unless you leave the house or a spouse dies. Another way to get money is to enter an annuity with an insurance company and either pay up front or a lump sum in order to receive a monthly income. And the last way is to pay for long-term care privately by receiving a trust from another person. So that's like a gift. And then there's also 2 different types of trusts, and that is a charitable trust, which is just given to you, and then a Medicaid disability trust. Extra info on that private pay. The younger you are when you buy long-term care insurance, the less expensive it'll be. So premiums do go up with age. So an example of that would be like you would want to buy at 50 versus 55. According to the New York Life, the 2014 cost of care study found that on average, the cost of a year's care in a private Medicare certified nursing home room was $95,706.65. Medicaid does cover long-term care if an individual meets the requirements. So in 2010, the requirements for someone who was the age of 65 and with an income of $931 a month was allowed and qualified for Medicaid. If an individual is 65, permanently disabled, blind, pregnant, or a child, you must be a U.S. citizen or meet those immigration rules. You must also have a social security number and be a resident of the state in which you're applying. And those all are things you have to have in order to qualify for long-term care Medicaid. Medicaid eligibility in Colorado. Like other states, Colorado has long-term care Medicaid eligibility. Sometimes in order to become eligible for Medicaid, an individual has to spend down, which means they have to get rid of those assets in order to qualify. Unlike other states, Colorado has a long-term care partnership in which individuals can mold private insurance and state funds together. And this allows the individual to not lose all those assets to pay for care. Resource limits for individuals are $2,000, and for a couple it's $3,000. The individual must be 65, blind, or disabled, and the individual must have received 30 consecutive days in a hospital or nursing facility. Some of those, you don't have to have all of those, just some of those apply. Faith-based long-term care is very similar to that of the secular care, although their mission statements are going to look a little bit different, and a lot of them are actually considered nonprofit. So an example is a Christian homes care community. It strives by meeting their vision, which is reach, which means they're trying to develop relationships, be meaningful in quality of treatment, appreciate and reflect God's love, and be compassionate and provide hospitality. Christian homes care community uses the money they are donated to be good stewards to the community in the best way as possible. So a recap, long-term care is expensive. An individual can either pay for long-term care themselves, or they can get Medicaid if they meet those requirements, or Medicare if it's not custodial. Long-term care insurance is available, less expensive the earlier you apply, and faith-based long-term care facilities offer a more faith-based approach in